Good evening and welcome to All About Money. I'm your host, Dhruv Tikekar. This week, we're going to be focusing on the findings of a report by Oxfam on rising inequality in Asia, especially in the wake of the pandemic. This took the form of women facing the brunt of increased economic and social costs during this time, as well as the emergence of so-called pandemic billionaires who profited from the global health crisis, while hundreds of millions lost their jobs, all on this continent alone. Joining me now to talk about this is Mustafa Talpur. He's the Regional Advocacy and Campaigns Lead for Oxfam Asia. Mustafa, thank you for joining us.
Thank you for having me.
This report obviously touches on quite a few areas, from the widening income gap between the very poor and the very rich in Asia, and obviously the disproportionate challenges facing women in particular in the region. But I wanted to start by asking about the issues already in place before the pandemic began. This is something your report also does touch on. What can you tell us about the level of inequality that was already there in Asia before all of this?
Yeah, thank you very much for having discussion on this very important issue of inequality. Before going to see where Asia was on the inequality, just give you a quick update on that. This pandemic has really been a bonanza for the Asian and the world billionaires, and you see something has exploded into their wealth. While poorest people were losing their loved ones, their jobs, um, but the billionaires' wealth has really multiplied many times. And the total wealth now, as we estimate, is $5 trillion in the hands of the few billionaires. And this is the biggest surge ever since the record has begun. And much of them is between the 10 richest people. And we estimate that even if these 10 richer people lose their 99.90% of the wealth, they will still be richer than all of us. But coming back to your question on Asia, so Asia was already on a very dangerous level of inequality. There were many reports from the Asian Development Bank, Oxfam, United Nations, academics, that there has been a reduction in poverty in Asia, but that is accompanied with the rising inequalities. So just give you some example from Asia. In 2018, top 1% people controlled about 1/3 of the national wealth in China, India, Indonesia, and 67% of the wealth in Thailand. So this is the pre-pandemic level. While the bottom 50% of the people owned only 8% wealth in China, 2.5% in India, 2.8% in Indonesia, less than 2% in Thailand. So these were the booming economies in the last decade that we saw. And in 2018, first time, the billionaires in Asia Pacific actually surpassed in any region in the world. Their number was 906 in 2018, while Europe had 558 billionaires, North America has 634, similarly a little lesser than the other regions. So the number of billionaires in Asia Pacific surpassed any other region was the sign that the inequality and the concentration of wealth is happening in the Asia. Just give you another example. Before the pandemic hit, 30 rich people in Thailand owned 10 times more wealth, just 30 people, than the bottom 50% of the population. And then 119 rich people in India owned 3 times more wealth than the bottom 50% people. So this was the level of inequality before the pandemic hit. So pandemic actually hit a highly unequal region.
Right.
At the same time, with this wealth, just give me a 30-second.
Sure.
Parallel to this number of rising wealth and the wealthy people and billionaires in Asia, there were 400 million people estimated to be living below poverty line in Asia. And United Nations Asia Pacific Office estimated that around 328 million people would have been lifted out of moderate poverty if the region matched their expenditure on health and education, as the word was showing, but they were not doing it. So we were living almost 700 million people in the poverty while these billionaires were getting richer and richer before the pandemic.
I did want to get to the issue of billionaires, and I just wanted to make a quick correction. I'd said in my introduction that hundreds of millions had lost their jobs. They'd in fact slipped into poverty. So I just wanted to make that very quick correction before we moved forward. But your report, and before we get to the billionaires, obviously, your report does mention that Asia has been dealing with outdated economic models. It's been in place for many years, which have only been making the inequality problem worse, especially during the pandemic. But some governments have also been adopting what you've called, or rather what Oxfam has called, progressive models that have been essentially, in a way, adapting to these changing circumstances. What can you tell us about these difference between these two economic models that we've seen from different governments in Asia?
Yeah, I think we documented in 2019 the progressive policies in the Asia what governments have been doing. Though these are not adequate, these measures have to be further strengthened, but there were some progressive elements that are happening. So just give you a quick example. Mostly in the areas of education, health, and social protection. So these are the policies that we think can address the inequality crisis. So one, for example, in Thailand's universal health scheme, that today covers almost 99% of the population. And a lot of studies have shown that it has reduced income inequality in the Thailand. Similarly, in India, there's a famous Kerala Public Health Services success is well documented everywhere. So when you provide a free health services to majority of the people, basically the poor people rely on the public services, on the health services.
Right.
And then you have Indonesia's health insurance scheme. You have free public health, education in the Philippines that actually increase the rate of higher people progressing to the higher levels of education. And then you have health and education in Korea, well documented, significant improvements on those ones. China has done a lot of miracles. China's health and social protection programs that has been successfully quoted, reducing poverty numbers. We have seen the Korea's basic old age pension scheme that has helped a lot of old age people to get out of poverty.
Right.
So these are all the policies that governments were introducing, but they fall short in addressing the level and magnitude of inequality that was growing up in the Asia actually.
Right. I mean, healthcare, in some sense, is a pretty good indicator of inequality in many of these countries. You talked about free health services that like countries like India were providing. I did want to ask you, because that does, in some sense, tie into social protection and issues like that. With this financial gap between the rich and the poor, there's also been an accompanying gap in access to healthcare as well. So even something as basic as clean water and soap, to be able to ensure that you have proper hygiene is not being met in many of these countries. And the report mentions that a lot of these healthcare problems come down to a lack of investment from the government into these sectors, in maintaining the health infrastructure, in making sure there's proper oversight of these systems. Just how bad is the situation in many countries when it comes to maintaining the system, when it comes to this oversight, and how much of the problem can we blame on the pandemic rather than on the governments themselves?
No, that's very much right. So even before the pandemic hit, the public health systems in the many countries of the Asia Pacific were very in bad conditions, and they were underinvested.
Right.
The glaring example is in India. So, for example, after the SARS, Vietnam invested more in the health system, and then Vietnam was the country being quoted as an example when the pandemic hit. They have the lower deaths and the lower incidence, while in India, a rising country, but it has spent less money in the health system, so it faced a lot of health problems. In overall, the Asia Pacific average spending on health is very lower. Just give you an example, in 2017, out-of-pocket payments accounted for 60% of health spending in Pakistan, Cambodia, India, Bangladesh, and Myanmar. So
just to clarify, this would be out-of-pocket expenses would include money that's not coming from insurance, or this is coming from people's pockets, quite literally.
Okay. Exactly, coming from people's pockets. So they were spending whatever they were spending on the health, their 60% was coming from their pockets. And then in May 2020, we found that 64% households in Indonesia and 50% Pakistan were unable to receive medical attention due to the lack of money. So when the pandemic actually hit, the people were unable to access the medical care. And in the Philippines, this number was almost 64%. It's estimated that in South Asia, so this was the condition and the low investment.
Right.
And what we think this is because gradually the governments in Asia have been pulled out from the public services. This has been left to the private sector to provide these services. While this has been a fundamental role of state to protect the citizens' right to health and a healthy living.
Right.
So when the pandemic actually hit in South Asia, so that it's not only the pandemic that caused the death, but because people can't access the health services, and associated problems actually cause more deaths. And so the disruption to health services caused around 228,000 additional deaths and around 11,000 additional maternal deaths in 2020 alone.
Mustafa, obviously there's a lot more to get to, but we do have to go to a quick break here. Do stay with us. We'll be right back.